Good morning, everyone, and thank you for joining this webinar. I am Nicolas Bouzan, and I am the Area Business Manager at QuantifiCare company for Western Europe. QuantifiCare is a French company with more than 20 years of international experience in 2D and 3D photography systems. Our technology, LiveVis, is the culmination of 2 decades of research work in stereo vision, resulting in a very compact and easy-to-use system. Our 3D systems propose unmatched high-quality image reproducibility, geometry, and are poised to become an intrinsic part of any aesthetic practice. Standardization, accuracy, reliability are fundamental for effective image analysis and documentation. Today, we have the pleasure to have Dr. Dalvi Humzah as our speaker for this webinar. Dr. Dalvi Humzah is the founder and medical director of plastic and dermatological surgery and free LiveVis mini user for many years. Dr. Dalvi Humzah will talk about the effects of radiofrequency on skin quality, tissue displacement, and even considering events with volume variation. If you have any question you would like to ask, please write them on the Q&A box and we will answer them at the end of this webinar. Thank you, and I see you at the end.
Hello, I'm Dalvi Humzah, and I'd like to welcome you to this webinar on using the 3D QuantifiCare system in analyzing results from radiofrequency treatment, in particular the InMode, Morpheus 8 and face-tight, neck-tight systems. I will take you through the ideal use of this technology and how it will help you to ascertain your results, and also how you can communicate with patients effectively using this technology. Firstly, I will look through radiofrequency methods that we use. Then we will talk about the evaluation methods, the advantages of using the 3D imaging for soft tissue displacement, and then I will describe to you some case presentations and how they have helped us in evaluating the results and treatment. Just a little introduction about myself and disclosure of any conflicts of interests. As you know, this is a talk specifically for QuantifiCare, and I also work with InMode as one of their KOLs and trainers. So what is this technology? The radiofrequency technology is combined radiofrequency as an internal and an external source. The internal source radiofrequency uses the face-tight, neck-tight platform, whereby radiofrequency is introduced from an internal probe to heat tissues up. You can see on the bottom corner how the tissues are heated up, and this can be used in different areas using different handpieces, and also as an external source using these insulated needles, the Morpheus 8, to cause contraction of tissues. So we can use it in 2 different modalities and also vary the depth of penetration with the needles. So that's the radiofrequency technology. And you can see here in a marked tissue how we can produce contractions. We're using a calipers to show that there is a 15% contraction in tissues following treatment. When we want to evaluate this in real clinical practice, we need to be able to assess volumetric changes, which is very useful to measure how the soft tissues have changed, particularly after contraction of tissues, and also the positional or vectoral changes, that is how the skin has moved. So these are different ways that we can actually look at how tissues have moved. Obviously, the calipers you saw earlier on is very useful for immediate measurements. It's very difficult to use it after treatment when you're following up the patients, and very difficult to standardize before and after comparisons. Other examinations such as an MRI, CT, soft tissue imaging is again useful for immediate and sometimes post-operatively, but can be very expensive and time-consuming. Using Computer-aided graphics with lines drawn on it, again, are quite useful, but again, difficult to standardize before and afterwards. And other physical measurements like pinch testing, half-face evaluation is all very useful immediately, but can be difficult to follow up patients using that technology or for using it for standardization before and afterwards. Other subjective evaluations are also useful, but again, does not give you any objective, true, quantified measurements. The 3D LifeViz, which I use, allows you to measure immediately post-treatment, after treatment, and is standardized. And what do I mean by standardized? Well, let me explain that as we progress. We know that there are variations in the amount of fat in a tissue, and the skin thickness varies in regions and also between patients. And when we treat patients, we need to be able to track and follow the soft tissue changes according to the treatment, according to time, and also specific events. So we need to be able to follow the patients up through these events, and having really accurate photo documentation pre and post treatment will allow us to follow these results and also then plan any future treatment that may be needed. So what can we achieve? Well, with the 3D QuantifiCare system, we can measure soft tissue displacements very accurately. It is a very small, compact and portable system, producing highly reproducible results which are standardized using the technology and the software, and the image quality is very high. So it gives you high D image quality. Now, how can we standardize this? Well, with the imaging, we can actually match the patient's image exactly. So it takes care of any positional changes of posture or position of the camera. The two images get linked together so that they are in synchronization when they're compared. They're identically orientated, and their proportion, because of the camera to subject distance is the same in all cases, is the same. And this allows point-by-point analysis of changes in tissue by superimposing soft tissue changes over each other, which I will demonstrate later on, and also to show movement of tissues, whether it be contraction or lifting. So here we have a system here. You can very quickly see on this patient how the soft tissue movement can be analyzed. You can graphically analyze the direction of movement and also measure the direction of movement. You can see above the eyebrow here, 6.23 millimeters of movement, 2.5 later on. So you can visualize all the movements, and you can show the direction of movements, how the tissue has moved, where the movement has occurred, and the final outcome. So that allows you to very quickly assess your treatments. Now, let's look at how this can be applied in real-time practice. You can see there, the images are now synchronized. You saw the movement there, and now as you move into different areas, you can see the synchronization allows you to assess before and after areas. This lady, you can see that little mole on her chin, how it has moved. We're superimposing a before and after to see the changes in soft tissue. You can see that mole having moved from below and it goes up. So there's been a vectoral shift in her face. And this can be shown using these tissue positioning that shows the 3.303 millimeters in the cheek, 4 millimeters just under the chin. Red shows a greater magnitude, yellow a lesser magnitude. You can see how the changes have been shown in different areas. We have more changes under the lower jaw, more around the temple, and that is translated to movement in the cheek. So that allows you to visualize. Again, here, second case. Here, the images are matched, and then you can see the before and after. Looking at the jowl, you can see there has been a change, but sometimes it's difficult to visualize unless you start superimposing. There you are, before and after. You can see how the before, the jowl is there, and then the jowl is treated and how the jowl is taken away. So the 3D analysis allows us to quantify this radiofrequency treatment, the before and after, and then we can look at the vectoral changes, greater vectoral changes under the jawline, as one would expect, because we have treated that area 7 millimeters to 5 millimeters, but the overall facial treatment showing the vectoral changes throughout the whole face, around the temples, around the preauricular region, and the direction of change allows us to then plan any further treatment and also to discuss with the patient and show them that vectoral change. Now here's a patient who has changes around the upper eyebrow region. We're producing a brow lift. We've made the images in sync, and now we can show those eyebrow changes there before and after. The elevation of the eyebrow, the opening up of the eye, that's easily shown, very easy to demonstrate to the patient and show those in detail using this little box viewer. And then we can look at the vectoral changes. Here we've got a very interesting case. We've got vectoral changes between 17 to 5 millimeters, but on that right temple, there has been a contraction rather than just a lifting. There's a contraction. Now, superimposing the images, you can see the soft tissue, the improvement in the neck, the changes in the soft tissue profile of the neck. And then we can look at the volumetric changes. Here, blue means loss of tissue, you can see that. And in the right eyebrow region, there's actually a slightly increased volume as the tissues contract and come together. And again, we can demonstrate that before and after change, the way the jowl has moved, the profile of the jawline and neck is improved using that little box viewer for before and after analysis. So that 3D analysis and vectoral analysis plus that superimposition of soft tissue profile allows you to really examine the face. And the last case here we're looking at, again, synchronizing the face and then showing a 3D profile. You can see the lower jawline profile is improved, but really to analyze it, we can come in with a before and after analysis, showing the before eyebrow and the after eyebrow, the elevation that's been achieved purely by using the Morpheus 8 on the upper eyebrow region and also the Accutite, which is an internal radiofrequency, to give you an elevation and eyebrow lifting. The vectoral magnitude can therefore be examined, and that can show the direction of the vectoral changes and also the magnitude. And then again, looking at the lower jawline, the profile, showing how the jawline has been improved, the skin texture, looking at the lip lines, you can see how those lip lines have been improved. Again, this is just purely using external radiofrequency around the lip lines, just showing an effacement of those lines and how it's improved the skin texture and quality. So this box viewer allows you to really focus in on that area and discuss with the patient all the different areas that have been treated and the outcomes that have been achieved. So finally, just to summarize, assessing skin contraction and skin movement is a real challenge. The different modalities available make it difficult to follow patients up throughout their treatment pathway. But a 3D system such as the QuantifiCare LifeViz allows you to align the facial features between 2 points, which is necessary to then follow the tissue movement. Using this 3D analysis, you can visualize the displacement, you can visualize the soft tissue movements, the volumetric changes, and really measure accurately the vectoral changes that take place following treatment, which is useful to communicate to patients as to what results they've achieved and also what further treatment can be used to improve and standardize their treatment pathways to give them the results they want. So the 3D LifeViz is a really viable solution to evaluate all these soft tissue movements and give you the best results to discuss with patients. Thank you for your attention. Thank you, Nicholas.